Thank you. Good morning, everybody. My name is Ling. I'm an EM consultant from London. I'm also a member of the EM Global Committee and part of the Royal College of Emergency Medicine. And I'm just going to talk to you for about 10 minutes about volunteering, and then we're going to open it up to a panel discussion and invite some questions from the audience as well. So let's start with a definition. What is a volunteer? A volunteer is someone who freely offers to take part in an enterprise or undertake a task. And I think that's a definition that's pretty well recognised by everybody here. But where does that concept actually come from? Well, if we look back to the early 20th century, this gentleman called Albert Schweitzer, he's a French-German theologian, philosopher, physician, spent a lot of time working in Africa. And he asked the question, why aren't rich colonial nations doing more to help the poor Africans in Africa? And he thought it was really an essential part of civilized Christian society to do so. And this really led to a real kind of swathe of enthusiasm to be involved in volunteering. And people went out to Africa and they came back with these stories of endurance and adventure, really romanticized the idea of volunteering. And in the 1960s, there was then a sort of sudden increase in volunteer organisations and charitable organisations. I'm sure you'll recognise many of these. They offer humanitarian work, development work, very much rely on large volunteer pools as well for them to be able to do their work of trying to reduce world poverty. But it wasn't really until the 1990s that the kind of ethics around volunteering really came into play. And that was amid concerns that there was this idea of a Western arrogance, that the Western way was the only way, and that people were practicing out of their scope of practice, and that we're setting up unsustainable and parallel health systems. And really that's what I want to focus on for the rest of this talk, is some sort of key questions that we should ask ourselves before we go and on our volunteer experience. So the first key question to ask is actually, well, why do I want to volunteer? Is it altruistic? Are we doing it for completely selfless reasons? I think we'd like to think so, for sure. But probably the reality is something a bit more about actually developing ourselves and wanting a challenge and wanting to feel good about ourselves. And my first volunteer experience was with an organisation called Rally International. It's a youth development organisation. It works in communities to build schools, water systems, mainly by gap year students, 18-year-olds. I went as a doctor and a project manager. And very much I went because I wanted the challenge and to develop myself. I had absolutely no idea what the projects were actually about and any of the kind of ethical issues surrounding volunteering. And I went very, very underprepared. The kind of flip side of that is maybe you're very clear about the objectives of the project and you really have an idea about what you want to achieve when you go. So a sort of second key question really is whether those objectives that you have are actually in line with those of the population that you're actually going to work within. I also worked with voluntary services overseas, VSO, and before going out to volunteer with them, you attend a pre-deployment course and they teach you about something called a TOB. Excuse for the language, but it stands for Target Orientated Bastard. And it's basically explaining this principle that if you go out with your clear objectives and what you want to do by finite timeline, and you're very targeted and driven, as often people are, it probably isn't going to be the best thing for the host population. So just to give an example here of some work that we did in Sierra Leone, setting up a triage system within a hospital. This wasn't we think a triage system is a good idea, let's go there and let's just implement it within 3 weeks. This required a significant amount of time to prepare for it, discussions with the hospital to find out if this was a priority, ensuring that we were able to implement it over the appropriate time fashion, which was 1 to 2 years, and still the ongoing involvement and supervision to make sure that that is sustained. Third key question, what else am I bringing other than good intentions? And a word that's on many people's lips at the moment is this concept of sustainability. In Malawi, which is where I worked with VSO, VSO have the concept of changing skills and sharing skills, changing lives. So really capacity building, working with the population to try and improve things after you leave. However, the hospital that I went to, I ended up being one of only 2 doctors, the other one who also was a volunteer. So I was in a situation where I was very much working independently and on my own, which, okay, that may have been quite useful for the population at the time, but what happened then after I left? Who was going to sustain and maintain what I'd already implemented or started doing without actually being able to build any capacity? And another example of this is in Sierra Leone. So this nurse is standing by an emergency drugs trolley. In Sierra Leone, patients have to pay for all of their medication. We were able to offer some medication for free to emergency cases, and this was funded as part of the Ebola vaccine trial. So it was great while the vaccine trial was ongoing, but when the trial ended, the funding ended. So that meant that those patients who were getting emergency care for free weren't able to get it anymore. What did we do to try and sustain that? Well, we thought about a replenishment scheme, so that's where patients would get the medication when they needed it, but then they would have to pay for it 24 hours later. Not perfect, but it kind of worked. And it's important to also think about the unintended consequences of introducing interventions like this when you volunteer. So most of the nurses don't get paid a salary, so they were actually selling drugs to patients on the side to be able to top up their incomes and to be able to feed their families. So providing medication for free to patients meant that nurses then weren't having the money in their pockets for themselves, but also it meant then why should they be interested in sustaining the intervention? Fourth really key question to ask is whether you actually have the right skills for the work. I'm sure we've all heard about what happened in Haiti after the earthquake and the fact that there were lots of unnecessary amputations. So it's really important to go out with the appropriate skills and knowledge. But also there's lots of other skills that are required, such as within quality improvement, within team building, time management, leading and teaching education. Things that actually probably are even more important because then you can build capacity and sustain work beyond when you leave. And so it's really important to reflect and think actually whether you hold these skills, particularly if you're quite junior within your career. Fifth question is to ask yourself whether your intentions are actually honourable. It's easy to think that working in an Ebola crisis and context, your intentions are very much honourable, but there were also some activities which came into question. So there was an Ebola treatment centre down the road from the hospital we worked at, which was trialling a drug called amiodarone, and they found that mortality rates were much higher amongst patients who've been given amiodarone versus not. Actually led to a lot of UK doctors walking out on the centre. So it's really key to think, if you're involved in research, well, what are the ethics around it? Have they gone through the right processes? Yes, there's an urgent need for research in this context, but is it appropriate? And then the final question to ask yourself is whether you actually have the right attitude to being a volunteer. You know, are you compassionate? Are you open-minded? Are you flexible, adaptable? Can you work in different and trying environments? So lots of things to think about, lots of information. There's ways that you can prepare for that sort of experience, certainly by finding a mentor, someone who's volunteered before, who can guide you through the process, certainly talking to other volunteers and your family and friends to know whether this is something you actually want to do. Clearly, you need to find out as much information about the project as you possibly can to ensure that this is something that's appropriate. And the key thing really is to be honest and explicit with yourself. Is this right for them, and is this right for me? So thank you. We're just going to move across to the panel now for questions, and you can also tweet your questions at EUSEM Global.